Flybe was rescued from near collapse in January. Now, cancellations and low demand following the outbreak have pushed it over the edge. 2,000 jobs are at immediate risk, with other workers in airports and supply chains also in danger.
Just all really sad, aren't we? Just really sad.
Flybe is far from alone. The global airline industry is suffering.
We could see the effect on revenues exceed 100 billion, around about 19% of global passenger revenues. This would be a revenue shock equivalent to what was seen in the global financial crisis.
Cases of COVID-19 in Britain have risen sharply. The government said Thursday the focus is moving from containment to delaying its peak impact. Planning is underway for the worst-case scenario, a breakdown in law and order.
There are long-established plans by which the police will, obviously they will keep the public safe, but they will prioritise those things that they have to do. And the army is, of course, always ready to backfill as and when. But that is under the reasonable worst-case scenario.
Across Europe, big gatherings are being cancelled or postponed, from trade shows to sporting events. The economic impacts are starting to bite. Italy has closed all schools and universities. In Venice, normally packed with visitors, the canals are all but empty. Tourism numbers are down across the world. Car sales in China have plunged by 80% in a month. Supply chains are disrupted. The IMF has slashed global growth forecasts. It's offering up to $50 billion for poorer countries that could struggle to deal with a coronavirus outbreak.
We do have up to $10 billion available for low-income countries to tap in with zero interest rates. And obviously we would prioritize countries, especially countries in Africa that have already been faced with difficulties.
Many African countries would struggle to cope with a large outbreak, according to a recent study published in The Lancet, which highlighted Nigeria, Ethiopia, Sudan, Angola, Tanzania, Ghana and Kenya as being among the most vulnerable.
Preventing the entry of the virus will become increasingly difficult, especially if the international spread continues. And given those data that indicate that the quality of care really has a strong impact on how serious it can be and how fatal it can be, I think that moving toward funding better healthcare in general would be quite a useful strategy.
The one bright spot, new infections in China, the source of the virus, continue to fall. Whether other countries can replicate Beijing's response remains to be seen. Henry Ridgwell for VOA News, London.